Brought to you by GTA. We start with you.
With Guam conducting testing for COVID-19 for the first time 2 days ago, Dr. Hoa Nguyen of American Medical Center tells KUAM there's a chance the island already has coronavirus cases, but since we haven't been testing, we probably just don't know it.
That's a possibility, like we have our island have so much tourists coming in and out, and I know they do the quarantine, the temperature monitor at the airport, but like the study showed, it's really, they don't really catch anyone yet with the temperature. I mean, there's no case that they catch people with a fever coming into the country, so more like we have it. Like I said, most 80% of this patient either have very low symptoms like cough and cold that we miss. So this possibility is here.
Public Health released new testing criteria late yesterday. Dr. Nguyen said the new criteria are more relaxed than Center for Disease Control parameters, but he said they should lead to more COVID-19 testing on island. There are two categories of criteria for testing. The first is for COVID-19 persons under investigation, or PUI. It only applies to hospitalized patients with fever, signs of lower respiratory illness, and a history of travel from affected geographic areas. COVID-19 PUIs also have to have fever with acute lower respiratory illness without another ailment that could cause those symptoms. Persons who have symptoms of the virus and have had close contact with a lab-confirmed COVID-19 patient also fall under the COVID-19 PUI criteria. The second category of criteria: surveillance cases.
Public health come with a term for a person under surveillance. Okay, that's the one that I think is kind of unique to Guam. That's where the guideline is in the gray area, where people don't really fit into the CDC strict guideline. That the physician deemed necessary to run the test to make sure that the patient does not have coronavirus. Just like in the state, as we find out, a lot of patients does not have any history of traveling to those high-risk areas.
Dr. Nguyen said more testing for COVID-19 needs to be done to avoid exposing vulnerable populations to the virus, those with existing ailments that compromise their immune systems.
The key here is to catch all this low-symptom patient so we can kind of isolate them, quarantine them, so they does not pass on to the general population in Guam. If you have a mild symptom, you can come across someone that have heart disease, diabetes, cholesterol, they're going to get in trouble, most likely.
Dr. Nguyen said he hopes communication between the government and privately run clinics improves. We asked him if doctors from those clinics, often the first stop for anyone who thinks they might need to be tested for COVID-19, had a seat at the table to help come up with the new criteria.
I'm not quite sure. Yesterday at the meeting with the governor, Public Health have a meeting, they say, with the physician, but I know that AMC, SDA, and FHP, we were not in that group of meeting to come up with the guidelines. Which is we're probably the three largest clinics in Guam, but we don't have the input on those.
You can watch Dr. Nguyen's full interview on our KUAM News Facebook and YouTube pages.
Brought to you by GTA. We start with you.